Hi guys, this is me JC. I'm recording this video to address the questions that I received about how I passed the NCLEX. So please pasensyahan nyo na if kung may mga ingay sa labas, tunog or tahol ng aso, yung manok mismo madidinig nyo kasi andito lang ako sa bahay nag-shoot. If you can see, of course, as you can see, ito yung mga study materials ko. It's just a percentage of it. There are other materials or visual aids that I have surrounded around this room. So please bear with me. So, yes, ako pala si JC. Isa po akong registered nurse ng Pilipinas. I graduated a decade ago. I in fact took the NCLEX the first time after I graduated. Unfortunately, I did not pass. So, ito po yung pangalawang attempt ko to pass the NCLEX. So, aside from that, nag-take po ako ng NCLEX sa Manila. Both of them happen to be in Manila. So, marami pong questions or marami pong nagtanong sa akin through my Instagram as well as Facebook and even Twitter kung ano yung mga materials na ginamit ko for the NCLEX. So, nilista ko po dito. So, please bear with me kung nagdadala ko or I'm bringing my iPad with me because my materials or my study materials are also here. So, first, I use the Saunders ebook because hindi po ako mahilig sa libro. Tapos, alam nyo naman yung mga medical books natin, masyadong makapal. So, tapos marami pa tayong libro. So, yun, I opted for the ebook na Saunders. Kaso, hindi talaga ako mahilig magbasa. So, I think mga 100 or 150 pages lang yung nabasa ko sa Saunders na ebook. So, kaya bumili ako ng audiobook. Yung audiobook na yon is by Mark Klimek. Good thing on that is aside sa audiobook, meron din siyang yung yellow at saka blue book. Effective sa akin yung Mark Klimek na audiobook tapos yung blue and yellow book kasi integrated siya. And when we say integrated, habang pinapakinggan mo si Mark Klimek sa lecture niya, gagamitin mo yung blue book para mag-notes. Tapos yung notes na yon or yung libro na yon, parang fill in the blanks na lang. So, hindi ka masyadong exhausted for you to write on or take note of the things that he's highlighting. Kasi, as what I mentioned, fill in the blanks lang siya. So, all you need to write on is the important term. And the good thing on that, once you took note of the important term, para sa akin, nare-retain talaga siya sa utak. Tapos, I did not just listen to it once or twice. I listened to it, I think 4 times during the span of my review. So, aside from the blue book and listening to his audiobook, after that, I also took advantage or utilized the yellow book. Yellow book is also like a refresher na ginawa ni Mark Klimek that comes with the medical terminologies and its definition. And you can also put side notes there on what to do with those things. So, yun yung maganda. That's the second material. The third material is I did attended a lecture with a review center online. I paid for about, I think 5,000 on that. It so happened na I was an enrollee of the class or the review center way back when I took the local board or the Philippine Licensure Exam for nurses. So they gave me a discount and then attended the class. That will be either 9 a.m. the whole day, or if that will be a night class, it starts at 5 p.m. or 4 up until 10. One disadvantage on my experience on attending the review online was there were times na um, hindi magtutugma yung lecture nila sa mga topics na binabasa mo through your self-review. So, parang mix up na yung mga let's say mini-memorize mo o yung mga nakabisado mo ng topic. So, yun yung isa sa mga disadvantage. Another is you have to rely on the lecturer's schedule or availability, because sometimes although that they will give you a schedule on the online review, there were times na absent yung reviewer kasi emergency, tapos walang reliever kasi minimal lang yung mga reviewers nila na expert sa topic na yun. So yun yung isa sa mga disadvantage. Advantage would be there will be a real-time Q&A because the online review was done through Zoom. So if in case may topic kayong gustong itatanong na expert doon yung reviewer, madali kayong maka-chat kayo kaagad kasi live nga siya. Pero yun nga, just in case na wala yung reviewer, absent yung reviewer, masisira talaga yung schedule or yung routine nyo. So, yun yung pangatlong material na ginamit ko. Yung pang-apat po is the online practice test. This is actually with UWorld. Medyo may kamahalan lang siya kasi it's an exclusive or parang subscription na online practice test. I highly recommend this tool or this review material kasi ito yung nagbibigay sa inyo or parang it will give you a real feel of how NCLEX would really look like or feel like when you take the exam. Kasi pare-pareha yung pagkakagawa ng questions ng UWorld tsaka ng NCLEX, yung structure at tsaka yung interface ng program nila, ang placement ng buttons, ng calculator, ng options, even yung kulay ng actual NCLEX, pare-pareho din ng UWorld. As what I mentioned earlier, yung UWorld medyo may kamahalan siya, pero I would recommend to maybe enroll or subscribe to this for at least 3 months of the service or the subscription. Kasi sa totoo lang, I had a very formal, very serious and tutok or focused review using this material for 3 months lang talaga. I did subscribe for a 6-month subscription, pero when it comes to yung my schedule talaga ako or routine na I have to take this number of questions, it took me mga 3 months. So yun yung UWorld. So again, hindi po ito sponsored ng UWorld. I just really like to let my fellow nurses know about this tool kasi it really helped me a lot. When I say it helped me a lot, it helped me create a strategy on how to answer questions like the select all that applies. And in addition, yung NCLEX nowadays is, they call it the new generation NCLEX, kung saan most of their questions will be based on a case study basis. When we say case study basis, bibigyan kayo ng isang kaso, tapos there will be series of questions on that certain chart or certain patient. So doon nyo talaga makukuha kung ano yung strategy or paano yun aatakihin or paano nyo atakihin yung question na yun. So mahahasa talaga kayo. Mahahasa talaga kayo when it comes to answering new generation NCLEX. And in addition to that, there would still be SATA questions. When we say SATA questions, that will be the select all that applies. Dati, yung select all that applies, pag mali yung isang sagot mo, mali na lahat. But with this new generation NCLEX, pag may SATA question kayo, I would advise to, if in case you only have one answer na sure kayo, yun lang yung piliin nyo. Kasi yung style ng SATA questions for new generation NCLEX is right minus wrong na. So, buti na lang, at least yung isang answer na correct, may point na yun. So, yun nga, kung yun lang yung sure na kayo na answer, yun lang yung isasagot nyo. So, yun yung SATA. So, marami pa talagang mga strategy na mabubuo ninyo when it comes to practicing NCLEX questions. Don't just rely on the paper printout kasi nowadays meron din yung mga paper printout na NCLEX questions, di ba? Maganda rin na meron kayong parang simulation when it comes to answering NCLEX questions kasi it will also give you the hint on how many minutes kayo nagstay sa question na yon, ilang percentage makukuha nyo sa question na yon or sa correct answer ng question na yon. And aside from that, you will also master how many questions that you should answer in this number of hours. So I will create a separate video when it comes to doing a strategy or let's say a routine on answering test questions like what we have in UWorld. So in addition to the test material that I subscribed online for UWorld, I also took a supplement with For Life. That's why it's here. It's called Recall by For Life. This is not a sponsored video, guys, but one of my friend introduced me to this supplement wherein it really helped me a lot kasi makakalimutin ako. Okay, aaminin ko, I'm already 37 years old. So it's been a while that I studied nursing. That's how many years ago. So I really forgot not really all, but most of the common medical terminologies, diagnoses, as well as even procedures. Buti na lang, meron akong experience when it comes to medical coding, which is hindi naman talaga related to hospital experience, di ba? So I got introduced to this product and it really helped me retain more information about nursing itself, or the medical terms, as well as the things that we should know when it comes to taking care of our patients. And that will also be implied when it comes to prioritization and case studies. So if you are curious where you can get this supplement, I will just put that in the link below or in my bio, so that I did tie up with them. But before I tied up with them, I did not really give them a proposal to maybe give me a reward when it comes to endorsing this product. But it would really help if in case that you will buy a product from For Life, it will give me a little percentage, and in that way I can also earn a little bit. But then again, way back before that tie-up, I already took this supplement. Again, it's For Life Recall. In addition to enhancing your memory, it will definitely boost your immune system because of their transfer factor that is patented with this supplement. And last but not the least, my fifth tool that I used for reviewing the NCLEX and aced the exam is, since I am a visual learner, I took advantage of the videos on YouTube. To be specific, I watched on the videos that is posted by Simple Nursing. That's the YouTube channel. So shout out to the creators on that. I believe he's Nurse Nike Linares. So thank you very much for helping me in retaining more information, or as we say, simple nursing. Let's say you can definitely absorb a lot of information with their mnemonics and easy to remember terms. So there. Ano pa ba? So far, yun yung 6 major materials that I used for me to pass NCLEX. But if in case you happen to have other questions about how what was my preparation, how I prepared for the NCLEX on the day and stuff, I will create another video on that, and just don't forget to put that in the comments below with regard to your questions. And for more information or more vlogs about my experience, please don't forget to follow me or subscribe to my channel. And about that, since we will be pursuing another career path, one of the reasons why I would really like to revamp my channel is maybe soon I will be migrating somewhere else, which would really change my life 180 degrees. So I would be changing my channels or social media accounts to another name. I know that I am really passionate when it comes to my travel, which is Big Ear Tours. That is my channel. But I will be shifting it to JCX, so that you will know more about me, what I do, what's my lifestyle, what are the normal things that I do in a day, if in case that I will publish it. And I just really like to share more about myself. So please don't forget to subscribe on my channels, as well as follow me on my social media accounts. That will be again JC Echo, that's JCECHO. And for that, just for me to help my fellow nursing students or fellow nurses ace the NCLEX, I would be giving away my notes, not the notes that I wrote, because I bet that it will be better for you to take notes on your own. But what I mean to say are the materials that I use, except for the URL, because that is patented and it's a subscription basis service. So what I will do is I will share the materials that I use electronically. All you need to do is comment below BET nursing or BET nursing, and then I will send you a message so that you can also send me back your email address for me to send you the electronic copies of the materials that I used. And in addition to that, I will also be giving away one watch. This is a smartwatch. I got this from the TikTok shop by I Am Jude Rico. So you can also follow him, guys. That's I Am Jude Rico. He's a good tech reviewer. So I bought this watch from his TikTok shop, and I will be giving this away to one lucky winner. And for you to join, please don't forget to comment below again BET nursing or hashtag BET nursing and hashtag be the winner, so that I can give this away to one lucky winner. And aside from that, for those who will be sharing this video, you can also put that on your social media, so that your fellow nursing students or other friends that you have who is studying nursing or NCLEX can get the notes that I will be sharing with you. Okay? So again, if you like this video and you would like to see more, please don't forget to like, share, and of course subscribe, so that you will not miss anything when it comes to my food trip, lifestyle, and travel. Again, this is JC for JC Echo.